where we'll be learning about two Health Canada programs aimed at reducing harm from toxic exposure to cannabis and chemicals. Parachute is pleased to present this webinar in collaboration with the Canadian Association of Poison Centers and Clinical Toxicology and the Pharmacovigilance Canada Public Outreach and Communications Working Group. Before we begin today's webinar, I'd like to acknowledge the land on which Parachute is located. For thousands of years, it has been the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, the Métis, and the Mississaugas of the Credit First Nation. Today, this land is still the home to many Indigenous people, and we are grateful to have the opportunity to work on this land. While we meet today on a virtual platform, we encourage you all to take a moment to acknowledge the importance of the lands from which we all call home. Welcome, everyone. I'd like to start us off with some housekeeping items. Firstly, this webinar will be recorded and a link to view the recording will be shared with you. The recording will be available on Parachute's YouTube channel as well after. We will also have time for questions at the end of the webinar. Please use the Q&A box at the bottom of your screen to ask a question as opposed to the chat box. We will also have folks monitoring the chat for any technical issues. At the end of the webinar, when you're leaving, you will be prompted to complete a short evaluation. This will take 1 to 2 minutes. Your feedback is valuable to us and helps us guide future learning opportunities, so please do take a moment to complete that evaluation on your way out. I want to remind all present today that it is currently National Poison Prevention Week. Poison Prevention Week will run until the 23rd of March. This year, Parachute is joining organizations across the country to endorse a theme of empowering people in Canada to know about poisons and how to prevent poisoning injuries for a safer tomorrow. I am going to put a link in the chat to our website where you can find resources for Poison Prevention Week, including key messages, a backgrounder, visuals that can be shared on social media, as well as a social media guide with ideas for posts you can make during and after Poison Prevention Week. I am excited to introduce our speakers for today's webinar, Sieara Plebon-Huff, Odette Bose, and Heloise Tachaeur. Sieara is a senior scientific evaluator within the Pharmacovigilance Division of the Office of Cannabis Science and Surveillance at Health Canada. In her role, Sieara aggregates, analyzes, and reports on adverse events involving cannabis products using real-world evidence from spontaneous adverse reactions, which can include reports of cannabis poisoning. She is also the Health Canada lead on a collaborative study with the Canadian Pediatric Surveillance Program, looking at serious and life-threatening events associated with non-medical cannabis use in Canadian children and youth. With a Bachelor of Health Sciences in Biomedical Science and a Master of Science in Health and Aging, Sieara brings a unique perspective to cannabis pharmacovigilance, using a lifespan perspective to characterize cannabis risks. Odette has been the Risk Communication and Public Involvement Officer for Health Canada's Chemicals Management Plan in the Alberta and North regions since 2017. She has experience in public outreach, where she engages stakeholders in health promotion and protection initiatives associated with human exposures to chemicals we use in everyday life. Prior to this role, Odette specialized for 17 years in contaminated sites and human health risk assessment with the provincial and federal government. With a master's degree in environmental engineering and ongoing studies in educational psychology, she integrates her passion in both domains to enhance knowledge translation practices. Heloise is the Risk Communication and Public Involvement Officer for Health Canada's Chemicals Management Plan for Ontario. The goal is to reduce health risks related to chemical exposures by connecting the public with easy, reliable information that can be turned into easy action. She has a double Master of Science in Environmental Science, specialized in environmental impact and climate change, and a Master of Public Health. Heloise is passionate about environmental health and uses her multicultural background and love of the environment to help individuals connect with their surroundings safely. Thank you so much, Sieara, Odette, and Heloise, for joining us today to present on your work. I will pass to you, Sieara, now to begin your presentation.
Thanks so much, Sarah. Oh, there we go. I will start sharing. Go. Okay, we should be good to go now. Okay, so
Thanks.
hello everyone, and thank you for joining us today and sitting through my presentation. Today I'll be talking to you about Health Canada's Vigilance Framework for Cannabis with a particular focus on cannabis-related poisonings. So the purpose of this presentation is fourfold. I'll introduce Health Canada's Vigilance Framework for Cannabis. I'll summarize some of the data on cannabis poisoning events that have been received by Health Canada, including some case examples. We'll highlight some Health Canada activities and resources with respect to cannabis-related poisonings. And then I'll also aim to promote some reporting of cannabis side effects to Health Canada. And in line with the purpose of this presentation, here's a quick layout of the deck that we'll be walking through for the next 20 minutes or so. So you're probably wondering, what is Health Canada's Vigilance Framework for Cannabis? Well, with legalization of cannabis in Canada came a need for collecting, detecting, monitoring, and assessing adverse reactions, otherwise known as side effects, related to cannabis, which is a key component of Health Canada's public health approach to legalization and regulation of cannabis. And this is highlighted by the fourth pillar here, to monitor cannabis use patterns, adverse reactions, and compliance. To do this, Health Canada established the Vigilance Framework for Cannabis Products. This work and framework support decision-making, knowledge translation, and communication of the health and safety risks of cannabis to the public so that they can make informed decisions about their cannabis use. This framework is led by my team, the Pharmacovigilance Division within the Office of Cannabis Science and Surveillance at Health Canada, but we are heavily supported by the Marketed Health Products Directorate within the Health Product and Food Branch, who collect, code, and house the cannabis adverse reaction reports within the Canada Vigilance database. This arrangement is super important because it allows for the centralization of all adverse reaction data for both health products and cannabis products, which is important for detecting signals of mutual interest like cannabis drug interactions. So where do reports come from? Cannabis adverse reaction reports are collected from a variety of sources, the majority of which are submitted directly to Health Canada by license holders who have a regulatory obligation to report serious adverse reactions. Consumers, healthcare professionals, including poison professionals like yourselves, medical cannabis clinics, and provincial retailers are all considered voluntary reporters under this framework. We also receive reports from other Canadian surveillance programs like the Public Health Agency of Canada's Pediatric Surveillance Program and the Canadian Surveillance System for Poison Information, of which you may be familiar. Moving into the data, the next couple of slides detail some of the cannabis-related poisoning data we've received since the implementation of the Vigilance Framework for Cannabis, which was initiated in October of 2018. So for the purposes of this presentation, I had pulled all reports we had in our database that fell under the standard MEDRA query for medication errors, and which were reported on or after October 17th, 2018. And for those who may not be familiar, MEDRA is the Medical Dictionary for Regulatory Activities, and it's basically an international set of standardized medical terms for signs, symptoms, diseases, syndromes, and diagnoses. It's almost like an ICD classification, but for regulatory activities. And at Health Canada, all events listed in an adverse reaction case report are coded using this dictionary. And the standard MEDRA queries that I mentioned, or what we call SMQs, are basically tools that facilitate retrieval of MEDRA-coded data as a first step in investigating drug safety issues in pharmacovigilance. They are validated, predetermined sets of MEDRA terms that are grouped together after extensive review, testing, analysis, and expert discussion. And the SMQ for medication error, which I've included in this presentation, has a variety of terms, including both poisoning and overdose. So since the implementation of the Vigilance Framework for Cannabis, there's been 160 cases in the dataset involving events consistent with poisoning. These terms and their coding frequency are detailed in the table on the slide. The majority of the cases were coded as accidental exposure to a product by a child. Of interest, there were also several cases citing product confusion. An example of this would be purchasing and consuming a THC product when you intended to purchase and use a CBD product. So these red boxes here highlight some of the terms that correspond with these product confusion related issues. And of the 160 cases, we identified 76% involved children, 50% involved females, 67% involved cannabis edibles, and 82% were reported as involving hospitalization. Health Canada also tracks all reports of adverse reactions or poisonings and complaints related to cannabis products that have harmed or are suspected to have harmed children or youth. Accidental exposure in children is an issue that we keep a close eye on, as one of the key mandates of the Cannabis Act is to keep cannabis out of the hands of youth. With that in mind, 76% of the identified poisoning cases on the previous slide involved children or youth. All of these cases involved individuals under the age of 14, and most cases involved females. 92% of the cases involving children or youth required hospitalization per the report. As you can see from this figure, 79% of the cases involved edible cannabis, followed by dried cannabis and unknown cannabis at 8% each. And then cannabis extracts were involved in 5% of cases. 83% of cannabis reported in these cases involving children and youth were from an unknown source, followed by an illegal source at 15%. Of note, unknown source is assigned where there's limited to no detail provided in the case report about the source of cannabis involved. So for example, they might not provide a product name, so we can't look up the product to see if it's from a legal or illegal retailer, or the source is not specifically stated within the case report. So with this in mind, it is possible that the cannabis involved in these cases may be from an illegal source. It could be from a legal retailer, or it could even involve homegrown cannabis. We just don't know because there's no detail. And because of this, it's really important to us that these type of product details be explicitly provided when reporting cannabis adverse reactions to Health Canada, because it helps us to accurately assess risk and develop more targeted risk mitigation strategies. And while these statistics are quite useful, they don't really provide much context regarding what led to the poisoning. And that's why I've included a couple case examples for us to explore. So our first example involves a child who was administered a legal CBD product for drug-resistant epilepsy. The cannabis was being used with a medical authorization and with the oversight of a neurologist. The child's caregiver had ordered the same product from the same licensed producer 5 times previously with no issue until the most recent occurrence where they accidentally ordered a high THC product instead of the CBD product. When factoring in dose and product concentration, we can figure out that the child was administered approximately 110 milligrams of THC instead of the intended CBD. Based on the pattern of purchases of CBD oil, the amount given to the child, and the comments from the caregiver that were provided in the report and through follow-up, this appears to be a serious case of accidental overdose, THC intoxication, and reappearance of seizures due to product selection error leading to hospitalization. So there were several factors that contributed to the product selection error in this case. First, the medical authorization from the neurologist didn't specify no THC, so the caregiver may not have paid as close attention to the cannabinoid concentration when purchasing the product. Second, an unintended consequence of plain packaging, which is required under the cannabis regulations, is that the labeling and packaging of a high CBD product looks very similar to the labeling and packaging of a high THC product, with very minimal distinguishing differences. And because online product selection is often left to the patient or caregiver, the onus is on that patient or caregiver to make sure that they are reading and understanding the label of the cannabis product at the time of purchase. And finally, there are limited technical checks performed by license holders when it comes to making sure that the dispensed product matches the description in the medical authorization, if one is provided, and or that the dispensed product aligns with what the patient has previously purchased. In this case, it would have been helpful if the license holder had flagged to the individual that the product they selected was not the same as the one they had purchased previously. This could have drawn the caregiver's attention to the discrepancy in cannabinoid content. And for context, this is what I mean by lookalike plain labeling. So these two labels meet the requirements for labeling set out in the cannabis regulations. As you can see, the only real difference between the two labels is the concentration of CBD and THC, which is often provided in a smaller font on the label. And just to reiterate, this issue is not unique to this case report. My team has identified the same issue in several other cases, often involving adults where they have multiple cannabis products within the home for different purposes and accidentally consuming the wrong product at the other product's dose, resulting in poisoning. So, for example, they may take a CBD oil at night, and then one night they accidentally take the THC oil at the CBD dose, and it results in some pretty serious adverse events being reported. Similarly, we have identified several other case examples where an individual has ordered what they thought was a CBD product and received and ingested a high THC product instead. And at this point in time, the only way to really make sure that an individual is consuming the right product is for them to carefully check their cannabis products at the point of purchase, check again upon reception of the product, especially if it's being ordered online, and then to check again before consuming the product, particularly when there's multiple cannabis products present in the residence. Here is a second, more novel example involving accidental exposure to a product by a child. In this case, a toddler was hospitalized after consuming dog food that was mixed with a cannabis extract of unknown cannabinoid dominance. So the parents had added cannabis oil to their dog's food to treat the dog's seizures. After consumption, the child experienced decreased level of consciousness and spent 2 days recovering in the hospital with administration of oxygen and IV fluids. In this case, there was really one key contributing factor, and that was accessibility of the cannabis. The food was left on the floor for the dog and was easily accessible to the child. The parents may have been able to avoid exposure, for example, by keeping the food in a room that was not easily accessed by the child, or by supervising the dog's consumption and removing the food once finished. This type of exposure aligns with the common messaging to keep cannabis high and locked whenever possible. And to help Canadians make informed decisions about cannabis, Health Canada supports public education and awareness activities on the risks associated with cannabis use and ways to reduce or prevent these risks. So let's just take a quick look at some of the current activities and resources. Of note, all these resources I'm sharing today are publicly available. I've included links within this deck, which will be made available to all attendees in both official languages. So public advisories. When there's a specific risk to public health, Health Canada may issue a recall or an advisory or a safety alert. As it pertains to cannabis-related poisonings, Health Canada has previously issued 2 public advisories. One was focused on accidental ingestion of edible cannabis products causing serious harm to children, and it was more general. And then the second one was on accidental ingestion of illegal copycat edibles, so edibles that look like popular candies and foods. Like the Cheetos there, and a common one we see is the Stoner Patch gummies that look like Sour Patch Kids. These advisories provide the public with information on how to avoid these exposures and what to do should these exposures occur. These advisories are also continuously updated by the program as necessary. In addition, in March of last year, Health Canada launched a new campaign on how to prevent cannabis poisoning in children. This included mailing brochures to households across Canada and publishing a dedicated webpage for information on cannabis poisonings in children. The purpose of the campaign was to help Canadians, particularly parents and caregivers, know how to prevent, recognize, and respond to cannabis poisonings. As such, the campaign focused on 3 key components: prevention, signs and symptoms, and actions upon exposure. There are also several other resources available from Health Canada and other health portfolio departments like public safety geared towards preventing cannabis poisonings. One refers to how to read and understand a cannabis label. Given the number of poisonings that have occurred due to product label confusion and look-alike packaging and labeling, this is a fantastic resource that teaches consumers, both new and old, how to read and understand cannabis product labels to reduce risk of overconsumption. Health Canada also has some information on safe storage of cannabis, encouraging individuals to keep their cannabis high and out of reach, keeping cannabis in its secure child-resistant packaging, and keeping cannabis locked to prevent accidental exposures, especially among children. Health Canada has also published information on reducing risk by choosing legal cannabis, of which has to meet certain specific requirements for product quality, promotion, packaging, and labeling as outlined in the Cannabis Act and its regulations. Specifically, illegal cannabis can contain harmful levels of THC. It can be packaged in unsecure packaging, and it may even look like popular candies, thereby increasing risk of accidental poisonings, potentially resulting in visits to the emergency department and/or hospitalization. In a similar vein, Public Safety has published some information on how to ensure you're purchasing legal cannabis products when purchasing cannabis online. Their webpage includes information on how to find an authorized retailer, signs of untrustworthy websites, and how to report illegal retailers if you come across them. And finally, the cannabis regulations actually require that licensed producers ensure that each shipment of a cannabis product is accompanied by copies of the consumer information sheet for cannabis. This fact sheet has information on the common immediate effects of THC. It has information on eating and drinking high THC products. It provides some information on the harms of cannabis use and ways to lower risks associated with use. While licensed producers have to provide this in each shipment and should be distributed to consumers at point of purchase, it's also made available online through the Government of Canada website. And finally, an important part of public education is filling data gaps. We can't really draft informative resources without the evidence, right? So one way we try to gain more information and fill these data gaps is through research collaborations. Specific to cannabis poisonings, one such study that attempts to better characterize cannabis-related poisonings is the Canadian Pediatric Surveillance Program study on serious and life-threatening events associated with non-medical cannabis use in Canadian children and youth. This is a collaborative study between the Canadian Pediatric Society, Public Health Agency of Canada, and Health Canada that was initiated in September of 2018, just before legalization occurred. It provides valuable information on pediatric cannabis exposures in Canada, including outcomes related to exposure and the source of cannabis involved in exposures, which is information that often isn't available in other data sets, like health administrative data sets, but it's critical to our understanding about the context of these exposures. And because of its utility, this study has been extended to 2025, and data from the study are also published annually on the CPS website, which is linked on the slide. In terms of next steps, our office continues to publish cannabis data and information for the public, particularly concerning health and safety risks associated with cannabis. We continue to engage stakeholders like yourselves, poison and health professionals, to improve reporting of cannabis side effects, including accidental poisonings. And we continue to monitor and assess side effects to help inform evidence-based public education materials on health and safety risks with cannabis. And the photos below are just some examples of where our data has been used to further promote public education of the health and safety risks associated with cannabis. And on that note, please do consider reporting any side effects with cannabis to Health Canada when possible. Again, these reports contribute to the identification of emerging safety issues, assessment of harms, sharing of learning, and improvement of knowledge on cannabis risks. And the link below goes directly to the reporting form. So it's super easy once you have the slide deck to click and report. Thank you for listening. Please don't hesitate to reach out if you have any questions, comments, or concerns. This is our generic inbox, and we are always quick to respond. Thank you so much.
Thank you, Sieara, for that really clear and informative presentation. And I will turn it now to Heloise and Odette to begin your presentation. Perfect, we can see your slides.
Okay. Awesome. Thank you for joining, everyone. My name is Heloise Tachaeur. I am the Risk Communication and Public Involvement Officer for the region of Ontario. Odette will be presenting, Odette Bose will be presenting with me from the Alberta in the north, a similar role. And we do have some of our contact information in case you do want to reach out, as well as some resources popping into the chat in the meantime. So we're here to give an explanation for how we approach reducing chemical exposure risks in Canada and strategies and resources for public safety. Next slide, please. Just want to check here quickly if the slides are moving or no.
It's kind of stuck. Just give me a second.
Okay.
And just flagging that we can't see your slides anymore. I'm not sure if that was intentional.
Yeah, I'm just going to reshare it.
Okay, thanks, Kathleen.
Okay.
Okay, we can see them again.
Okay. Okay, perfect. So before we start our portion, our presentation today, we just want to do a brief land acknowledgement as well. So our session can be viewed from many places. With gratitude, we acknowledge the Inuit, Métis, and First Nation ancestral and unceded territories on the land in Canada. Please take a moment to acknowledge the past harms and mistakes and consider ways to move forward in a spirit of truth, collaboration, and restoration. So to give a little bit of context from where the three of us are from, we are part of we work for within the environmental health program. So the environmental health program is a national program that promotes healthy and safe living, working in recreational environments by identifying and assessing health risks to people in Canada caused by environmental factors. And also by reaching out to people in Canada to raise awareness of risks and health impacts related to environmental factors and mitigation strategies to help address any risks. So the Environmental Health Program's outreach and engagement mission is to empower people in Canada to take action on environmental risks to human health and by motivating behavioral changes, influencing individual and community resilience. Our program is comprised of 5 sections. So we have the impact assessment section, contaminated sites, air quality, the chemicals management plan, and radon. Since we're from the chemicals management plan, we'll focus there. The chemicals management plan is a jointly managed initiative of Health Canada and Environment and Climate Change Canada. Through the CMP, the Government of Canada assesses and manages risks to human health and the environment posed by chemical substances that can be found in food and food products, consumer products, cosmetics, drugs, drinking water, and industrial releases. Chemical safety is a shared responsibility between the Government of Canada, the industry, and the individuals. So just to give context, there is one of us in every region. So we are national. So the chemicals management plan, we work under the concept of healthy home. Its objective is to provide science-based information that motivates the public to protect health by reducing environmental risks produced by chemicals and pollutants in and around the home. Its intended audience is with families and young children, homeowners and renters, Indigenous peoples, at-risk populations. And by at-risk populations, we refer to seniors, people with health conditions, pregnant people, and newcomers. Our program works under a collaborative approach. So the Environmental Health Program works with the Risk Management Bureau's Communication, Outreach, and Engagement Division to deliver public outreach on the CMP and environmental health. Our key healthy home topics include indoor air, water quality, radon, and chemicals found in consumer products. So this slide here, I begin to explain how we reach our target audiences. We often work with intermediaries to reach children and their guardians and caretakers using programs such as the Train the Trainer program with early childhood educators or ECEs, with newcomers centers. We work with organizations that have connections with relevant networks. So one example from the Alberta region, from Alberta, is the Safety Day programs in schools, working with Alberta Health Services. And in these kind of programs, it's worked in the classroom, so the classes are divided into small groups of 10 to 20, rotating between stations where students receive information on various safety topics, about 15 to 20 minutes time frame, and each station includes vital information complemented by hands-on activities and demonstrations. We also serve as guest lecturers at different institutions, different organizations. For example, with ECE students and post-secondary schooling. We give lectures at lectures to health and human services students and post-secondary schooling, such as nurses and community support workers. We often attend conferences such as teachers' conventions and library conventions, and we create collaborative partnerships with nonprofit and community organizations such as Eco Schools and Nobody's Perfect parenting programs. Just want to highlight here to the right, the image here is an example of our collaboration with Eco Schools. This is one of several action cards that were developed with Eco Schools, and this is just a portion of one. It explains actions in the background about chemical safety and reading the label, and has activities and resources associated that students in schools can utilize. So as we're talking more about children, their caretakers and guardians today, we here on this slide, you have some of our key messaging and how we relay or how we communicate to parents, to guardians and caretakers. We do this so that they can help model these behaviors and be a positive example for children on how to manage their risk. So we share a message such as that children may be, in comparison to adults, children may be more sensitive to harmful effects of chemicals. They often have higher exposures. They're more reliant on others to protect themselves. We provide some tips to protect children, such as locking away household chemical products, keeping them out of reach, that children wash their hands after play and before eating, to practicing safe use of arts and crafts material, teaching children to recognize and understand hazard symbols, making sure that products are approved for the child's age. And of course, we always advise that if you suspect a poisoning, that you call the Poison X number, which is a little bit different depending on your region. So if in Nunavut, it would be to contact your local health center, and Quebec has a separate number as well, shown here on the slide. And of course, in an emergency, of course, call 911 if you really are fearful of your child or child's condition. So, and on this slide here is also an example of how we would highlight our messaging on chemical safety in the home. We look at it from 4 aspects, from making decisions around household chemicals, when purchasing, when using, when storing and disposing chemical products. To give an example under the context of when storing, we suggest that people keep chemicals or store chemicals in their original containers so that key information about hazards, usage, first aid is still there, and that chemicals are not confused for other products inside the home. And for using, especially for younger children, we teach them that hazard symbols mean danger, do not touch, and to contact a responsible adult. And for children that are a little bit older, we educate them on what the different hazard symbols mean and what actions are associated with those. So we have on our website, we do collaborate with different programs. And so we have information on how to use pesticides, for example. We have worked with the Cannabis director as well in providing information, working with them and promoting safety as well. And I'll pass it now on to Odette to continue on the presentation.
Yeah, so our main tool that we use to raise awareness about poison harm reduction is through our free Healthy Home sessions. We are able to meet the different clients' needs in these sessions by completing them either in person or virtually. We focus on different topics in the Healthy Home portfolio, and we can do them for different durations. We develop these sessions for the appropriate audience using relevant examples, activities, and discussions, whether it is for guardians or caregivers of children, children or youth themselves, educators, community support workers, or healthcare providers. We try to make these sessions an active learning experience for participants and therefore include activities during them. These can include starting sessions with a quiz, roundtable, or game. The purpose of these tools can be to find out what participants know about chemicals. We may start by asking, what are some chemicals that you have interacted with since this morning, to get discussions started? Activities like the ones also shown work. In this first example, we will ask participants, consisting of people who work with young children, to find the household chemical product in the collection of kids' candy. This reinforces to guardians and caregivers how easily it is for a child to confuse a dangerous chemical product like a laundry detergent packet with food like candy. Another common activity we start out with is a grab bag activity. We customize these bags depending on the audience for the types of products we will include. A common item we include to educate about potential hazards for children is costume jewelry. When we pull this item from the bag, we ask participants, what chemical do you think could be of concern for costume jewelry? We then discuss with participants how lead is a soft, inexpensive metal used to make costume jewelry. That wearing costume jewelry containing lead does not cause harm. However, as young children often do, sucking, chewing, or swallowing the jewelry can cause many harmful effects to the children's bodies, including death. Attendance of trade shows is another key communication strategy we use for outreach. We attend these trade shows targeted for our intended audiences, as we discussed earlier. For example, trade shows like the Mom, Pop, and Tots fairs or Healthy Expos for guardians, families, and children, and conventions we attend and conferences for librarians, educators, community support workers, and healthcare providers. We have many interactive displays at these trade shows, such as the one shown here. This is Boris. It's a body check contaminants display of a human body. It features 12 chemicals, where upon pressing the button for a specific chemical, the system or the body parts that could experience health effects from that chemical will light up. Sheets also go along with the display that identify the chemicals, how we can be exposed to them in the home, ways we can minimize our risk, and where we can find resources on them. We also have many handouts and resources that we give out at these trade shows. For example, we recently handed out the parachute magnets advertising the new Poison X number. These handouts, of course, also include our numerous healthy home publications and resources that we will be reviewing in the next couple of slides. A resource we have specifically for children includes our environmental health activity book. It's a story about 5 fearless kids who try to solve the mystery of their adorable cat, Peppercorn, who starts to feel sick. It involves mystery, comics, activities, puzzles, and more. This teaches kids about the hazard symbols and how chemicals and medications should only be handled by adults. Children learn about how they can be exposed to potentially dangerous items like medications and cleaning products and how they can enter the body. They also learn ways that they can protect themselves, like checking with adults before consuming anything, washing their hands, and why people wear gloves when handling cleaning products. The comic also introduces kids to some common chemicals that are found in the home through a coloring activity and a description for older children and parents to share with younger ones. As seen in the Healthy Home Session lookalike activity, there is also an activity for children on bringing awareness to how potentially harmful products or substances in the home can be easily mistaken for safe food, drink, or other products. We also have more activity sheets for even younger ages. These really start to introduce children to the hazard symbols and to different health risks that can be in the home. And just recently, we came out with our Healthy Home Challenge. That's an online game. Players can go through 6 different rooms of a house to identify 7 to 12 different hazards in each of the rooms. Once you identify a hazard, you'll be asked a challenging question related to that hazard. As an example, we have the bedroom of the house where there are 9 hidden hazards. If we select around the room with the magnifying glass, different items will light up identifying the different hazards. Here, we select the medication and the other items that can be found on the side table. Once we select these items, we are tasked with answering the question: which of the following must be kept out of the reach of children? A, prescription medication. B, natural health products. C, over-the-counter medication. D, cannabis products. Or E, all of the above. We would next select our answer, which I will choose E, all of the above. And we are told that we are correct and that we should lock up our prescription drugs, over-the-counter medications, cannabis products, and natural health products. Keep them in their child-resistant packaging, out of sight and out of reach of children and pets. A key message that we try to make sure to get across is that all things are poison and nothing is without a poison. Only the dose makes a thing not a poison. Therefore, it is important that even things like natural health products be kept out of the reach of children, as they can be harmful too in the wrong dose. Also, through Healthy Home, we work with a lot of different programs and departments across Health Canada and the government, which can include the radon, air quality, air, water quality, product safety, cannabis, food, natural health products, pesticides, and the Public Health Agency of Canada. We also have an exciting board game called My Healthy Home. It's a hidden objects game for ages 9+. It asks people to find all the hazards in the home. And it has a presentation that goes along with it as well for the full learning experience. We have numerous other public outreach resources that we use, such as our online Healthy Home content, social media pages like Facebook and Twitter, videos, publications, and partnerships. Healthy Home content relevant for guardians and caregivers of children for poison harm reduction would include our pages like Look Up Chemicals and Pollutants, Household Chemical Safety, Exposure and Health Effects of Chemicals, Use of Arts and Crafts Materials Safely. While relevant publications would include our 10 tips to protect your family and chemicals and pollutants, as shown here, our Healthy Home Guide, and tips for pregnancy and preparing for baby. We've been able to provide translation as well of our publications, like our 10 tips guides, into many different languages as shown. This allows us to be able to reach a much broader audience. We have a total of 12 videos online. The majority of them highlight the tips from the 10 tips publication. The video we have here as an example provides a valuable resource to guardians and caregivers of children on how to use arts and crafts materials safely with children. That's just an example of it, some of it. So thank you for attending today's webinar. A French version of our presentation is available upon request. And if you are interested in connecting and collaborating with us, you can find Heloise and my contact emails in the chat. We would also be very happy to connect you with any of our colleagues across the different regions of Canada.
Thank you so much, Odette and Heloise, for your presentation. And I want to thank Heloise and Odette, and as well Sieara, for emphasizing in your presentations resources for the public and for families. I know that this will be really valuable to our audience. So I think we'll start the Q&A session now. We do actually have just over 10 minutes for Q&A. So I'll invite all of our panelists to come on camera if you can. And I would like to introduce just a couple of other folks we're going to have join us for the Q&A session. So we're going to have Shahid Perwaitz, Manager of Pharmacovigilance Division of the Office of Cannabis Science and Surveillance at Health Canada, joining us. Thank you, Shahid. And we'll also have Kathleen Yan, Risk Communication and Public Involvement Officer for Health Canada's Chemicals Management Plan for BC, join us as well. Thank you, Kathleen. So I'll invite our audience to submit any questions you have for the speakers in the Q&A box. And we do have a couple questions to kind of kick us off while folks type their questions out. So I'll start with directing to our cannabis folks. We have a question about packaging regulations for cannabis products, and I know Shahid, you addressed this a little bit already in the chat or in the Q&A box about the prohibitions listed under the Cannabis Act. But in particular, we had a question about some of the copycat products that came up in the presentation, and I'm wondering if you could speak in a little bit more detail about the situation with these products. Are these products legal? If not, what's being done to regulate them? If they are legal, how are they fitting with the Cannabis Act? Yeah, just looking for some more detail on that, I think.
Oh, that's a very good question. Like, as I mentioned in the chat, that we do have a very solid regulation in place in terms of packaging to prevent so that the packaging doesn't look like appealing to the young kids, and plus they all come in the child-resistant packaging, so just to avoid the accidental poisoning of kids. In terms of copycat products, we do, first of all, we always encourage the consumers to access your cannabis product from the legal store. So what I mean by legal store, they're already being, I would say, approved by Health Canada. They already made the requirements in terms of quality and safety. And where we also look at the packaging, whether or not they're conforming with the packaging requirement under the cannabis regulation. And in terms of illegal product, copycat product, we do have an compliance enforcement policy in place to take the appropriate action. And we do encourage people, if they see those kind of products on the market, please inform Health Canada. We could share the link where they could file the complaint.
Thank you so much. Fantastic. And I wanted to also direct a similar question as well to our chemicals management plan folks about packaging for products that are appealing to children, brightly colored, that kind of thing. Are there regulations around this, or how would you respond to the question about packaging being appealing to children?
Well, I think that would be something we'd have to ask our product safety partners. They're the ones that inspect and would be like, we'd have to, if there's someone that is asking that particular question, we'd probably have to refer them to someone from there. So we'd probably have to get their contact information and do that, because we don't regulate that in our chemicals management program. So we don't deal with the packaging at all. We just kind of work with the product safety. So we're not experts in that at all. We just try to educate on the chemical lookalikes, because that's, yeah. So we'd probably have to, there was a particular person that asked that question that we can get their contact information?
I don't know if we'd be able to trace it back quite specifically, but maybe what we could do, Odette, is do it in our follow-up email out to all registrants. So we can circle back, and then we could provide maybe some detail in our follow-up Does that
Okay,
work?
sure. Yeah. We can
Perfect.
get in touch with product safety and ask them that question about chemical safety packaging and find out, ask them about that and see what regulations are out there for that and what they look for and stuff like that for children and stuff for sure. Yeah.
Fantastic. Thank you, Odette.
Yeah.
Okay, I think we have maybe one more question at the moment. And again, I'll welcome our registrants or our attendees rather to submit their questions in the Q&A box if there are any others. But just turning back to our cannabis folks, and I know Shahid, you had mentioned child-resistant packaging in passing there as one of our regulations. But I'm wondering if you could just speak a little bit more to the child-resistant packaging requirement. What does that look like? And is that for all cannabis products that are sold in Canada? Yeah, could you just elaborate a little bit more on that piece? Oh, sorry, I think you're muted. Thank you.
No, that's another very good question. I think I'm not sure, but I'll let Sieara jump in. But I'm pretty sure that all cannabis product in Canada has to come in child-resistant packaging.
Yeah,
And and the most important thing is the question. The person who asked this question, like we are doing a lot of education. There's some limitation associated with it, but we, like I emphasized in my earlier response, that we encourage people to acquire or access their cannabis product from a legal source, just to avoid those nonsense, basically, whether or not they are containing high amount of THC, the packaging is not conforming as per the cannabis regulation, and maybe lookalike, sound-alike product where there's a lot of risk of medication error or packaging error or dispensing error. So if they acquire their products from a legal source, you could avoid those unnecessary potential to get some kind of health risk associated with cannabis induced poisoning, whether it's in adult or in kids. It can happen in any population if you're not paying attention on the ingredients, if you're not paying attention on the dose, if you're not paying attention reading the label properly. You might end up into some sort of over poisoning, like with cannabis or THC induced intoxication.
I'll also add to Shahid's point, in addition to the child-resistant packaging, legal cannabis edibles can only have a maximum of 10 milligrams of THC total per package. So if you see a cannabis product that has 100 milligrams and it looks like child's candy and stuff like that, like it's not legal. Don't purchase it. You're increasing that risk. It's often not in child-resistant packaging. So that's kind of where we're seeing a lot of these accidental poisonings in children. So also another reason to shop legally when you're looking to purchase specifically cannabis edibles. And I think just to point back to all the resources I shared in the slide deck, like knowing how to tell if the cannabis you're purchasing is legal is super important, because we do see a lot of confusion about whether a product is legal or illegal. We know through like conversations with our colleagues at Public Safety, a lot of these websites online are really, really convincing, and it's super hard to tell that they're not legal and they're not selling you legal products until you potentially get them in the mail. So just being aware before you purchase, and if you're trying to scope out a new type of source, keeping those things in mind when you're purchasing can go a long way in preventing these accidental exposures and accidental overconsumption.
Thank you, Sieara and Shahid. And I see Sieara has put in the chat as well a link to report any suspected non-compliance products. So thank you for that as well.
And I can also share the link how to recognize a legal product. That's going to be very helpful. Okay.
Absolutely. Thank you, Shahid. If you want to put that in the chat, that would be great. And we can certainly include that in our follow-up.
Okay.
Yeah. Perfect. Thank you. We have a question here for Odette, Heloise, and Kathleen. Great initiatives on informing Canadians of pollutants and other health hazards in the home. Do you think the public is more or less aware of them? We used to be able to advertise more on TV commercials and such. How are you advertising things such as the book and board game and other knowledge products?
Well, I think we're using our online resources a lot, like our our website is really, like, really useful for that, and our social media, pages and things like that, and getting out to the trade shows and doing our healthy home sessions, like I feel like personally, like in my region, too, like the teachers conventions, like I find that I've gotten a lot, like now in the curriculum, like in Alberta, I'm from Alberta, so I've learned that, the healthy home is now in the elementary curriculum about safe use of household products in the health elementary curriculum now. So a lot of the teachers have expressed that. So I've gotten a lot of teachers asking me for the activity books, the environmental health activity books. So we give those free to the teachers. So I've been actually sending those out to a lot of the teachers. We've been trying to get in touch with a lot of, maybe babysitting courses and home alone courses by Red Cross and different organizations to kind of get the activity book out to them and maybe get into those courses and get that type of information in there. So, like there's a lot of good partnerships and word of mouth and online stuff. I find that, and the trade shows are really good for that. So it's really positive to hear, like I said in the curriculum too, that it's out. And then I've heard through the other regions that, they've seen it in their curriculums as well popping up. So, and then in the older grades too. So, and with the board game as well, that's just something new as well. So a lot of teachers were really interested in that. So, yeah, it's really cool, to see that type of, I'm and the Healthy Home Challenge game online too. That's just new as well. So, it's really exciting to see that stuff, and I think that's really getting people, thinking of this stuff in a new way, and like even I just had yesterday with some seniors I was doing it with, and for them too, it was exciting with the Healthy Home Challenge game, to get them thinking of it that way, so yeah, for sure. I don't know, Heloise and Kathleen.
To give another example, yeah. So we do offer, for example, in Ontario, we're partnering with Eco Schools with our action cards. And one of the resources, so we do provide some of these resources. For example, the Healthy Home game, the new hazards game that came out, they're now posted on the action cards on Eco Schools. And so Eco Schools themselves will do social media posts about their program. And then at our side on Health Canada, we will help and amplify their posts on social media and kind of try to bring it forward even a little bit further. And then, from the videos and other aspects, we're looking at ways to amplify it. So we're looking at ways, for example, like getting health institutions, public health institutions to maybe just post them on their public television screen. So often they'll be in, hospitals or medical centers, you'll have those displays.
Yeah.
Where we're trying to get our videos kind of posted into those as well when they're relevant, because they do have subscripts and transcripts, and so they can be made quite accessible for multiple audiences as well.
Fantastic. Thank you, Odette and Heloise, for that answer. We do have a couple more questions, but I see that we're actually out of time. So for any further questions, we'll send those out in follow-up to our registrants. So I want to thank one more time our speakers for today for the excellent presentations and all of the resources that you have put together and made available to the public. And we will be sure to include the various links that have come through the chat in our follow-up as well. Okay, thank you everybody and have a great rest of the day.
Thank you.
Thank you.